Imagine hosting a beautiful summer family reunion where everyone gathers around the backyard grill, completely unaware that a hidden danger is lurking inside the main course. Dakota to share a rare meal. Black bear meat harvested by a relative during a hunting trip in Canada. So he followed expert advice and kept the meat inside a household freezer for 45 full days. They believed this cold treatment had completely sanitized the meat, a safety rule that actually works perfectly for standard commercial pork. Unfortunately, the microscopic parasites hiding inside this specific wild game belong to a rugged species that is completely immune to sub-zero temperatures. The family threaded the dark mahogany meat onto skewers, unable to visually judge the doneness as the kebabs began cooking over the open flame. Because the meat was naturally dark, the chef couldn't spot a pink center, and the first batch was accidentally served rare to the guests. Days after the gathering ended, several relatives began experiencing stomach pain and nausea, which they easily dismissed as typical, everyday food poisoning. This initial discomfort faded quickly as the swallowed larvae matured inside the digestive tract and prepared to launch a stealthy internal invasion. As the adult parasites multiplied, they released thousands of newborns directly into the bloodstream, migrating far away from the stomach area. The patients felt a brief wave of relief, mistakenly believing they were getting better while the organisms were actually settling into their muscles. Weeks later, the second wave struck, causing severe fevers, extreme muscle pain, and causing the delicate tissue around their eyes to swell completely shut. A 29-year-old man became severely ill, visiting the hospital multiple times while doctors struggled to figure out what was causing his suffering. The diagnostic system began to glitch, as early blood tests for this condition often mimic rare autoimmune diseases or specific blood cancers. What makes this parasite terrifying is its ability to hijack a human muscle cell, rewiring it completely into a protective capsule called a nurse cell. The worm builds a tough collagen wall around itself and even forces the host body to grow new blood vessels to feed it. This barrier shields the invader, meaning standard antibody tests come back negative for weeks, and treatments cannot easily reach the walled-off larvae. The mystery was only solved when a doctor finally asked the right question about the patient's diet, instantly uncovering the hidden bear meat connection. The true shockwave hit when investigators realized that two family members who only ate the grilled vegetables had also become infected. The microscopic larvae had cross-contaminated the vegetables on the shared grill grates, proving that even cautious eaters were completely exposed. Months later, a public health laboratory thawed out a tiny sample of the leftover meat and discovered hundreds of active worms still wriggling inside. 15 weeks in a deep freeze had absolutely no effect on this specific strain, exposing a massive loophole in traditional game safety knowledge. Fortunately, all 6 affected family members eventually recovered, though these durable organisms can linger inside human tissue for years to come. While government inspection heavily guards the meat in supermarkets, wild game remains completely wild, leaving safety entirely up to thorough, high-heat cooking.